So we are going to go ahead and get started. Good afternoon, everyone. My name is Elizabeth Aloni. I'm with Schneps Media. Schneps Media is the largest local media company in the New York metro area. We publish over 80 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, Manhattan, the Bronx, Staten Island, Queens, Westchester, Long Island, the East End, Philadelphia, and even Palm Beach, Florida. But today we are thrilled to bring you a very important webinar as it is Osteoporosis Month, and we're going to talk about what you need to know about bone health. You know, healthy aging requires strong and healthy bones, and today we're going to share information about how to build and maintain strong bones for life and what to do if you've broken bones or have been diagnosed with osteoporosis or low bone mass. So I'd like you to meet our esteemed panelist, the Bone Health and Osteoporosis Foundation CEO, Claire Gill. Welcome, Claire.
Hi, thank you so much for having me.
Of course. I want to share a little bit about you. Claire joined the Bone Health and Osteoporosis Foundation in January 2013 after a 20-plus year career in public relations and marketing for national nonprofit organizations and public relations firms with Fortune 500 clients. During her tenure at BHOF, she has served in various roles, including Chief Marketing Officer, Chief Mission Officer, Interim CEO, all prior to assuming the full-time CEO role in May of 2020. Claire has led all of BHOF's consumer and professional education programs. She created and launched BHOF's Break Free from Osteoporosis campaign, which generated hundreds of millions of media impressions from 2013 to 2016. As Chief Mission Officer, Claire created the Healthy Bones Build Them for Life Patient Registry, a first for the osteoporosis industry. She also helped to launch the National Bone Health Policy Institute and created the Coalition to Strengthen Bone Health, consisting of 14 leading aging, caregiver, and bone health patient organizations. The Bone Health and Osteoporosis Foundation, BHOF, was previously named the National Osteoporosis Foundation and changed its name in October 2021. In September 2019, Claire founded and launched the National Menopause Foundation to bring about a positive change in how people perceive and experience health at midlife. She now serves as founder and board member. Claire is a native of New York and graduated from Syracuse University, and she now resides in Lorton, Virginia with her husband and daughter. Welcome again, Claire.
Thanks so much.
Very impressive.
Yes, I love being able to talk to New Yorkers because I tend to talk at New York speed, I'm told. So I think the audience will be well used to me.
We certainly appreciate that here. I know that I do. So let's get started with the basics. What is osteoporosis?
So osteoporosis actually means porous bone. It is a disease of the bone. It's a chronic disease. And sadly, about 10 million Americans suffer from osteoporosis right now, and another 44 million are impacted by osteoporosis having low bone mass, which means that they have a greater increase of fracture risk. So when we talk about why bone health is so important, it is because the way we imagine ourselves carrying out our lives and living into our, hopefully very well into our golden years, is being active and doing the things we love to do. And unfortunately, if you suffer a fracture due to osteoporosis, that often can be very debilitating and can change the course of how we experience our older years. It's kind of a myth, though, that osteoporosis is just an old person's disease, because I've had one of our board members explain it really interestingly as a pediatric disease that manifests as we age, because we build all the bone density we're going to get by our mid-20s. And then the body just recycles that bone and rebuilds it year over year throughout our lives. And for women, we have a dramatic loss at menopause due to the loss of estrogen. We lose up to 20% of our bone density in the first 5 to 7 years postmenopausal, which is why sometimes we think it's just a woman's disease, but it's not. Men get osteoporosis too. It just doesn't have such a dramatic drop for them at midlife the way it does for women. So that's really what osteoporosis is and why we should pay attention to it.
That's amazing information. That information should be given to anyone right before they even have a child, because to understand really the importance of bone health. I mean, obviously, unfortunately, I'm well above 20, so I can't worry about the past, but certainly in terms of raising and educating future generations about how important bone health is really from a very, very young age is critical.
We aren't told about that, you know, and I think, you know, it's really important, as you said, not only for our own health, but for, you know, as you said, the next generations, our children, our grandchildren, that we're making sure that they're doing all they can to build peak bone mass. Interestingly, what we do to build peak bone mass is also what we do to maintain good bone health. So we can talk about that a little bit if you like.
You know, let me ask you first about the risk factors, because I think, you know, that's something that we all need to be aware of to be able to prevent further bone loss.
Yeah. So there are controllable and uncontrollable risk factors. So the uncontrollable risk factors are being a woman. As I said, we have loss of estrogen as we hit midlife. So therefore, we become a greater risk. Having a thin frame. So you're a lovely normal thin framed lady. I am a big boned lady, as I like to say. You know, I'm finally like, oh, great, big bones, something that I don't have to worry about. But unfortunately, family history is also an uncontrollable risk factor. So my mom had osteoporosis, which means I am at greater risk for osteoporosis. But we can't do anything about the frame we're born with, right? And if you have a smaller frame, no matter how dense and wonderful you make that bone, there's only so much of it. And so that is a risk factor. Some other diseases impact osteoporosis as well. And so again, that's kind of uncontrollable. If you're taking medication for breast cancer, for example, or prostate cancer for men, diabetes, gastrointestinal issues, autoimmune diseases, so many things impact our bone health. And those are all uncontrollable. The controllable risk factors are eating a healthy diet, getting lots of fruits and vegetables. Anything that we do to maintain our overall health also helps us, you know, maintain our bone health. So you got to make sure that you get enough calcium and vitamin D in your diet. Those are the two most essential nutrients when it comes to bone building. All healthy diet, you know, vitamin C, vitamin K, potassium, protein, good fats, all of that are important too. But calcium and vitamin D have been shown to be the key ingredients and nutrients for bone health. So those are really important. Don't smoke. We've all been told that for many, many years now. Don't drink too much alcohol. I always find this one interesting because the limit is 2 to 3 drinks a day in order to make sure that you're not impacting your bone. And so I always joke that if you're drinking more than 2 or 3 drinks a day, osteoporosis isn't your biggest problem. Right? And not being sedentary, making sure that we're getting exercise. And we all need that, again, for all of our, you know, cardiac health and our brain health and everything else that we do to keep ourselves healthy. So those are some of the biggest risk factors.
What is the difference from an exercise perspective? Because I had heard about this, and you know, you're the expert. I don't know what's true and what's a myth, but you know, is weight-bearing exercise more beneficial for bone health than cardio, or is it really the same?
Well, cardio can be weight-bearing. So weight-bearing just means on your feet. So for bone health and to continue to make the bone reproduce itself, you need impact, right? Walking, running, dancing, anything that, again, is on your feet. So things like swimming and bicycling, while fantastic for your cardiovascular health and so many other things, and you shouldn't stop doing those, they're not the actual leading ways to increase your bone health. So you need to be on your feet. And then in addition to weight bearing, muscle strengthening. Obviously, what surrounds our bones and protects them are our muscles. So we need to continually make sure that we're doing muscles, you know, exercises as well. That can be lifting light weights. Don't worry, you're not going to be a bodybuilder. It's just literally light weights. Stretching, things that help with our balance are also obviously good for our muscles, and that also helps our bone health. So those are the 2 leading things that we think of when we think about exercise for bone health.
Fantastic. And people also need to think outside of milk when they think calcium. There's a lot of, you know, I think people automatically just think milk, and, you know, with people being lactose intolerant and all these other things, but there's many other leafy green vegetables and other things that can be very rich in calcium.
Yeah. And there's lots of things that are fortified now. You've probably noticed with calcium and vitamin D, you can drink orange juice. That's, fortified with calcium and vitamin D. So there's lots of other opportunities, like you said, to get calcium from our diet that don't have to be dairy, if that's not something that people enjoy. It's just easier to get it from dairy, obviously. And we also know that some people just aren't able to get enough calcium in their diet if they don't like to consume dairy and some of those other foods that are rich in calcium. So we always say it's always best to get your calcium from food first, and then only supplement for the shortfall in your diet. Because I know there's a lot of questions people might have about supplements, and we hear a lot of conflicting information about supplements for sure. But what we are saying when we say food first is, so if you do say eat cheese, and you might have cheese on your sandwich or do something, and then you might be getting 350 milligrams of calcium from that particular food. Well, then you don't need to take a 1,200 or 1,500 multivitamin calcium supplement, because you've already had 350. So you kind of need to keep track a little bit and deduct what you're eating, and then making sure that you're making up for the shortfall. If you're 50 and over, you need about 1,200 milligrams. Women need about 1,200 milligrams of calcium a day. Getting more calcium, write it down. Calcium. We have it on our website too, so you don't need to keep track of everything here. But women need 1,200 milligrams of calcium a day. If you're under 50, then 1,000 milligrams a day. But getting those numbers is really important. Getting more than those numbers doesn't really provide a benefit. So it's not like, just consume all the calcium you can. No, you should actually make sure that you're just kind of reaching the recommended daily allowance, and then that's really all that you need. Vitamin D is a little harder to get from our diet, so often people need to supplement for that. And most healthy adults, and I want to make sure that we talk about a little bit of the difference between healthy adults and people who are severely vitamin D deficient. This pale woman right here. Healthy adults need only 800 to 1,000 international units. That's what they're called when it comes to vitamin D. That's the healthy adult normal part. If you're someone like me, and you might have other conditions that also require more vitamin D, then you might need to take more vitamin D. And supplements tend to be the easiest ones, unless you like to eat sardines with the bones in. Fantastic for vitamin D. Or as we said, whole milk that has vitamin D fortified, or orange juice that's vitamin D fortified. You can also get it from the sun. That's the natural way to get vitamin D. We just have to remember that you need to be outside with no sunscreen on, with your upper body exposed, your arms, your face, your chest, etc., for about 15, 20 minutes to be able to get the vitamin D that you would need from the sun. And obviously, we're all concerned about skin cancer, so most of us don't leave the house without sunscreen. So that's why supplementation, plays a bigger role for vitamin D.
That makes a lot of sense. Thank you. So can the change in our bone health and osteoporosis in general be prevented? Is it just something that's going to happen, and you can take some supplements and do a little better, or is it something that can be prevented?
It really depends. Unfortunately, as I said, there are those uncontrollable risk factors. So there are so many people that reach out to us at the Bone Health and Osteoporosis Foundation and say, I've done everything right. I've exercised my whole life, and I eat a well-balanced diet, and I've never smoked. And why do I have this chronic disease? And that's hard to, share with people, that there's just some things you can't control about it. It doesn't mean you can't improve your bone health. Right? And the things that we talked about as far as eating that healthy diet and making sure that you get the right level of exercise are all great in maintaining whatever bone density you have. And that's so important. And the other thing is that there are fabulous treatments available for osteoporosis. As much as it is a chronic disease and there is no cure, it is a highly manageable disease. And we all play a role in our treatment plan, because even the medical treatments don't work as well if we're not getting enough calcium and vitamin D in our diet. So it really is a sort of holistic approach to our bone health. Some of us may need to have, interventions as far as medical treatments. And they, as I said, are highly effective. They prevent fractures up to 70%. And when we compare that to, say, some of the other things that we might have to take medications for, The osteoporosis medications are actually more effective than all of the medications that we take for heart disease and high blood pressure and even diabetes. So it's, again, no one wants to be told that they have to take medication or that they should take medication. We don't have to do anything, but that, it would be beneficial. And really, that's just to prevent fractures. Can be deadly if you have a severe fracture. And we don't think about that. And I know sometimes people don't want to, think about the worst case scenario, but unfortunately, when it comes to our bone health, the worst case scenario is breaking your hip. And I think many of us probably know, and I mentioned my mom had osteoporosis and she broke her hip at 81. It was my daughter's first Christmas. So we spent that Christmas in rehab hospital with my mom. But for hip fractures, unfortunately, the statistics are 25% of people who break a hip are dead within a year. That's unheard of. And it's really more a downward spiral that happens after the hip fracture. 25% will end up having to go to an assisted living or nursing home, and the remainder will need to use an ambulatory device or like a cane or a walker. So really, it is important that we prevent those hip fractures as best we can, but we want to prevent any osteoporotic fracture. And we consider any broken bone except your head, your fingers, or your toes are considered osteoporotic fractures if you're over the age of 50 and you break a bone from a fall from a standing height. And that doesn't matter if you slip on the ice in New York, which I hear all the time, or, I just fell off, stepped off the curb and I broke a bone. Yeah, you shouldn't break a bone. You bruise, right? But we shouldn't break a bone. So if you're over the age of 50 and broke a bone from a fall, no matter how the fall happened, except maybe a car accident or a skiing accident, something like that, you should have a bone density test to see if osteoporosis was the underlying cause.
Well, speaking of that, how is it diagnosed? How would one find out that they have osteoporosis or that they are in danger of having it?
So there are several ways. The most common way is through what's called a bone density test. It's also called a DEXA that you might have heard of. And that stands for dual absorptiometry X-ray, which is crazy. DEXA, much easier, or bone density. It's a non-invasive test, and it is kind of the gold standard where it can tell you what your risk of osteoporosis is or what your bone density currently is. It provides you with a T-score. It's named after some scientists. That's where the T comes from. But generally, it's comparing your bones to that of a healthy 30-year-old. That's how the test is set up. And if you have a negative 2.5 or greater T-score, that qualifies as osteoporosis. Anything between, negative 2.4 and negative 1 is considered low bone mass. And sometimes it was referred to as osteopenia, but it just means low bone mass. Now, the tricky part is the fracture. You can have low bone mass, but if you've fallen and fractured, then you're considered osteoporotic, whether or not the low bone density is minus 2.5 or not. Your doctor will do an evaluation. They have a lot of different things that they can calculate your fracture risk from. So they'll look at, again, your family history, other comorbid diseases, as I mentioned, sometimes diabetes, heart disease, breast cancer, prostate cancer, all of those things. They'll look at all of those things, and they use a tool called FRAX. It's FRAX. They plug in some of these key elements, and they gives you a risk factor for breaking bones out to about 10 years. So what is your risk factor for the next 10 years? And that's oftentimes what clinicians will help use to diagnose osteoporosis.
Okay. When should one go to start getting bone mass measured, if that's the right terminology?
Well, when we should and when it's covered by insurance are two different things. If you have a family history, like I said, if you know that anyone in your family, mother, father, aunts, uncles, grandparents, etc., had osteoporosis or particularly broke a hip, you should talk to your clinician again about getting a baseline bone density around menopause, around your early 50s. Right now, the clinical guidelines are that all healthy people should get a bone density. Women should get bone density at 65, and men should get it at 70. But again, so many people need to get that bone density test ahead of time. And you really need to talk with your clinician about what your risk factors are and whether or not you should be tracking that earlier.
I actually just had my first bone density test, and I have to say it's very easy. What?
So simple, right?
It's so easy. You just lay there and basically in 2 minutes.
I tell people all the time, and as women, we experience so many tests that are really invasive and uncomfortable. Mammograms, colonoscopies, and yet we get those, and we have, we know to do them, and we do them regularly. There's an 80% care gap of women who should have a bone density test that don't get a bone density test. So I often say, maybe we should tell women that it hurts and it's really embarrassing, and we'll line up to get them done.
Right. We're such martyrs. We're such martyrs. Yeah, no, it was very easy. And I did learn, I don't have risk factors. I've exercised my whole life. I eat a healthy diet. And I was like on that verge on half of my body. And so I'm going to be beefing up my vitamin D and calcium because, but it's good to know so that you can do as much as you can to prevent further bone loss.
That's exactly it. We just want to be able to know, like, knowledge is power. And then, like you said, when you know, then you're able to continue to either change things or improve things or keep doing what you're doing just to manage it and know and be aware and start looking at things you can do to prevent falls. Right? That might be like coming off the stiletto heels that many of us have worn forever and doing all of those kinds of things that, have to adjust a little. I do want to go back to the comment where you said you're half your body. So yeah. It is interesting, even though the test shows, on your left vertebral or your left your hip, if you have osteoporosis in one area, it means you have osteoporosis. It's not like arthritis where I have a little arthritis in my right hip, but
right.
It's not. It basically, that's just the test saying where it noticed it, but we don't categorize that. So you just have it on your right side or your left side. You have osteoporosis. Yeah. Right. It might mean though, like maybe your right hip or your left hip would be weaker, right. If you fell. Mm-hmm.
That makes a lot of sense. So how is it treated? Let's say you find out, you have osteoporosis, you go for your bone density test and they say, yes, you have osteoporosis.
Well, is it just the vitamin osteoporosis? Yeah. Most clinicians will tell you that you need treatment, or they'll suggest it to you. And again, this is a decision between you and your clinician. And I know we hear from a lot of people who say, I don't want to take treatment. I just want to do lifestyle changes, because not all of us are living optimally. And I certainly fall into that category where I'm clearly not getting the right diet and exercise that I need. So again, many people are like that. I don't want to do something. I want to just, do my own steps to take care of it. And that's fine. And your clinician should respect that. However, they should be telling you that then you need to be monitored pretty closely. You should then maybe have a bone density test every year, right? Versus every 2 years, which is when the general Medicare population can have a free bone density test. And by the way, on Medicare, it's free every 2 years. So if you're not worried about your risk factor, you don't know whether or not your grandparents or your parents had it, you're still entitled to get a bone density test on Medicare every 2 years. And I highly encourage people to do that. But again, if you've been diagnosed with osteoporosis and you still don't want to, consider treatment, then definitely figure out a plan with your clinician, with your healthcare provider that says, I'm going to make these changes. I'm going to make sure I'm getting calcium and vitamin D. I might start an exercise program if I'm not already on one. I'm going to make sure, stop whatever bad habits I might have, if it was smoking or et cetera, and then continue to be monitored. I know people, again, like I said, we don't like to talk about treatments, but the treatments are really, as I said, very effective. And there's quite a few of them. So I want to talk a little bit about the types of treatment. Please. You're often, first of all, as we are in our lovely health system, you're going to be offered probably the generic form, right? They often offer the cheapest medication available. And so, and that's fine because those are effective. A lot of what we call the biphosphonates are the treatments that people start with. But if that type of treatment doesn't work for you, please advocate for yourself and talk with your clinician about trying another treatment that might suit you better. We all are different. And fortunately, there are treatments that come in oral form. There are infusions where you can go into your doctor's office and they'll give you, an infusion of the medication, or where you can get a shot. And so we want to make sure then again, however you like to take your medication, that you consider those options as well. And it's also, if you might experience a side effect that makes you uncomfortable and you don't like it, consider another treatment versus saying, I'm not going to take any treatment. We don't think about that. And it's not something, again, I have another, a chronic disease that it never occurred to me that that was an option, but it is, where it's like, I hate giving myself shots, but taking a pill, I'm kind of used to, so I don't mind that. So have that conversation with your clinician about what's right for you. I also want to talk a minute about, the other thing is about side effects, because I know some of the people are, asking about that too in the chat. So everything has side effects. Aspirin has side effects. We have to remember that. So the idea is, again, to find the treatment that works for you where this side effect, whatever it might be, is really tolerable. So one of the medications I took and I share with people all the time made me flush. So you can imagine with this really pale skin, I was full on red. But after your body adjusts to the medication, which took me about 3 months, gone. And works really well for me. And I basically now have been on it for 15 years and it really manages my condition very well. But that getting over that hump of, oh God, 3 months of this flush every time I took the medication, that was something, again, I was able to tolerate and manage. And so it's really important you have that conversation with your clinician about what are the most common side effects of this drug. Sometimes it's upset stomach, but like I said, aspirin can cause that from people, right? Some people can't take aspirin because it's a little bit of upset stomach. It's upset stomachs, it's those kinds of things. But generally, if you continue on the medication, the side effects go away.
That's really great advice. Don't be afraid to talk to your doctor and ask. Don't be afraid to see if there's something else if you're having a problem with the current medication.
Absolutely.
And don't be afraid to risk a potential side effect for the value that the medication can provide. So thank you for that. I think that's really important.
And it's also, again, that it's everyone's risk factor and risk tolerance is different. And so it's really, I think the more important conversation is balancing your risk of fracture versus your risk of getting a rare side effect or having an intolerable side effect. If you're going to fall, potentially fall and fracture, and that could cause something very debilitating versus getting a rare side effect. I mean, that's the balance equation that we're looking for.
Right. Do you have any advice for bone? Once someone, let's say, breaks a bone, they're over 50, they've fallen, not off a mountain, and they broke a bone. Is there anything in that healing process that can be more helpful or less helpful with your future bone health? Or is it really?
It really depends on your history with your bone health, because what we do know is once you've had that initial fracture, your risk of fracturing again, if you fall, increases 3 to 7-fold. It's crazy. And why that's so concerning is because so many of us, again, trip over something or break a bone, or I broke my wrist, or, I broke my ankle, and nothing's done. The orthopedic fixes the broken bone and sends people on their way. And there's no conversation about, oh, you might have osteoporosis and you should check for that. And sadly, that's because there's not enough clinicians know enough about osteoporosis and how to treat it. So we really do have to be our own best advocates when it comes to that. And sadly, I can't tell you how many patients I've spoken to where they've had 3, 4, 10, no lie, where they've had that many fractures before anyone said, we should get you a bone density test. This is unusual. Maybe there's something wrong.
Right.
So really, once you've had that first fracture, make sure that you get something. And then there's other people who suffer fractures without having any kind of fall. People with severe osteoporosis can break a bone from a sneeze, a hug. I mean, things that you just would never imagine. And the other thing is to consider too, especially for the younger people, if you've had breast cancer and you've had your ovaries removed, you'll enter menopause early. So again, you might be 30, 35, going through menopause and not thinking about, oh, well, what's my bone density going to be? But then that means at 35, you've already lost estrogen. And so you might be susceptible to fractures too. So we need to consider all of those things. And it's very individual, but on average, as I said, it tends to happen as we age. And it's something to pay attention to more and more as we age.
Wow, thank you so much for that. This has been really enlightening. And I know we have a lot of questions from our attendees, and I'd love to turn to it. But right before we do, is where can people go to get more information? What is your website?
Yeah, so the website is bonehealthandosteoporosis.org. Unfortunately, the BHOF acronym was taken. If you do go there, funny enough, you're going to go to a burlesque house. I kid not, that's who owns BHOF, and a church in the Bronx.
Interesting.
So we have to spell out bonehealthandosteoporosis.org. But if you Google, bone health,
I'm also putting it in the chat, and I'll also share it with everybody via email. Everyone tomorrow is going to get an email, a thank you email with the recording of this, and also this website, so that you can go there too. But it's right here in the chat.
And I also want to encourage people, if you send an email to info@bonehealthandosteoporosis.org, that reaches everybody on our staff. We're a small staff, but we're a mighty team. So that's the easiest thing to do if you have a specific question or need some support. We do have online support groups. We have local support groups. And then we can also tons of information and materials available on the website. But it can be overwhelming. I understand. So if you do just kind of need help with, direct me to exercises that you have available, or direct me to more information about nutrition or what types of medications, please reach out and we're happy to share that information.
Thank you. I love that. You really make this something that can feel very overwhelming, very manageable, and you make it easy for people to be able to find the information.
And be hopeful, right? What I'm saying, when it comes to things we could get in life, this, again, being a manageable disease with excellent treatments that actually prevent fractures is a good thing. I know sometimes we get, you get diagnosed and then there's a huge fear factor, and then trying to sort all of that out, But again, break it down piece by piece. Have a good conversation with your clinician. If you're not getting information from your clinician, then reach out to us and we'll, again, try to provide you information to be able to do it. Because unlike some other chronic diseases, all clinicians can treat osteoporosis. So your primary care, your gynecologist, an endocrinologist, a rheumatologist, a geriatrician, or an orthopedic could all treat you for osteoporosis. Yet their level of knowledge about osteoporosis is not the same. It's not like going to a cardiologist when you have a cardiac issue, or going to an oncologist when you have a cancer issue. In osteoporosis, part of that is we're sort of like the orphan, that everyone can treat it. So sometimes it's hard to find someone who has that expertise. Please reach out and we'll help you find someone who has that expertise in your area.
That's fantastic. Thank you for that. So let me jump to some of our questions. There are a lot of great questions. Alpha wanted to know, how often should an older woman in her 70s get a test? And I think this is a good question, really all on board. How often should people be getting testing?
Yeah. Again, it depends on what your T-score is, right? If you're a healthy adult with no history of osteoporosis, once you get your first bone density test, if it shows that you don't have low bone mass or you don't have osteoporosis, it might be 5 years before your clinician will recommend another one. Or again, if you did get a baseline at 50, because of a family history and it shows your bones are great, it might be 5 years. But otherwise, as I said, take advantage of the fact that Medicare allows you to have a test every 2 years. That's a good indicator as you continue to age on where your bone mass is. And is it staying the same, right? Are you doing everything that you should be doing? Where are the ups and downs? How can you improve? And certainly if you are on treatment, it's important to be able to have you and your clinician sort of track again. Are you stable? Is stabilizing on the treatment? And basically no fractures and no increased loss means the treatment's successful. Right? It doesn't have to mean that you're going to go back to being the healthy bones of a 30-year-old. That's not where the treatment takes you. It literally is making sure that you're not continuing to lose bone loss or that you're not fracturing. So, consider that when you're thinking about those ongoing bone density tests. And then again, talk with your clinician about whether or not you need to have it more frequently. People on treatment tend to have it once a year versus waiting 2 to 3 years.
Terrific. Thank you for that. Julianne wanted to know, if you're not taking medication, can you actually rebuild bone, for example, with weight-bearing exercise, or can you only stop further deterioration with vitamin D and calcium and exercise?
Generally, again, you're trying to maintain the bone you have and not lose any more bone. People do, though, especially if they haven't been very active or if they haven't been having a healthy diet, they might see a little bump up on the bone density, but it's not enough to, again, you're not curing it, I think, is the most important thing to notice. Again, you want to stop that deterioration. And you want to make sure, again, if you're not on treatment, but you have shown that you have low bone density or osteoporosis, make sure that you're getting the bone density test so that you have a clear picture of what's happening with your bone density. And if it's maintaining through diet and exercise and you're cool with that, then that's the conversation you have with your clinician. But, most of us will want to know, I want to know if it continued to drop, right? And really increase my risk of fracture. And so that might be a different conversation than with your clinician about it. So some of the newer treatments, and I saw someone ask about a specific new drug that came out in 2018. Most of the drugs that were on the market since the 80s are about, again, helping with the remodeling process, the breaking down and building back of bone. Producing too much bone or too little bone is generally what happens when osteoporosis or bone disease is involved. So most of the medications were about slowing down that process or increasing it. The newer medications actually do both. They can prevent loss and they can help to build back bone. That was a pretty exciting development. Yeah. In the field. It tends to be those at greatest risk for fractures who qualify for those medications. Keep in mind, they're going to say, this is our healthcare system. You have to start on this medication, and then you can progress to these others if they're not working for you. You need to talk with your clinician about what's the right treatment for you and where are you on that scale and how high is your risk to be able to determine what treatment is best for you.
Thank you. Thank you. We have a couple questions around similar thing about calcium absorption. And maybe this is something they can find on the website or that you may know about. Barbara wanted to know, do prunes help? And Gail wanted to know if there are any foods that actually hurt calcium absorption. Do you know about that? Or is that something that people can find on your website?
Yep, you can absolutely find it on our website. We have a lot of information about calcium and vitamin D, obviously, in different formats too. I mean, we have written publications, we have videos you can watch, we have short little sketch things that describe the different types of calcium. But in general, as you said, there are a lot of different types of foods that have calcium in them. And prunes, as you mentioned, is one of them. And there's been a lot of studies about prunes. The thing is, you have to consume about 8 to 10 prunes to get the recommended calcium that you need. And so that might wreak havoc on your digestive system. So think about that. But yes, prunes are a healthy snack and they absolutely do contribute. And again, we have a list of all kinds of nutrients and examples of foods. We even have a cookbook you can buy in our store, which is really interesting. But there are lots of things. Now, the things that detract from calcium absorption are also in there. So it's a little confusing sometimes because green leafy vegetables like spinach, we encourage you to eat, yet there's a nutrient within spinach that kind of stops or blocks calcium absorption. So it's a little kind of confusing sometimes, but it depends on the type of leafy green that you're eating. And it's not generally, the consumption amounts would have to be so high that to counteract what you're doing as far as a healthy diet, that really the method is if we eat a well-balanced, healthy diet, and that's what you and I have been told to do since childhood, the My Plate, from the USDA about what we need to have as far as what's healthy with proteins, lean proteins, good fats, healthy vegetables, 5 servings of fruits and vegetables, all of that should actually get you the nutrients you need. And so the things that you just want to, again, maybe keep track of are your calcium intake to make sure you're getting that 1,200 milligrams and your vitamin D. And the vitamin D is really a conversation to have with your doctor because you need a blood test to determine if you're not getting enough vitamin D. So that's a little bit trickier, but it's a simple blood test and it can be done with a panel that you're having anyway. And if your bone density showed that you did have borderline osteoporosis or you were having stuff, that should be something that your clinician would do as a routine part of your follow-up exam.
Okay. And there was a question here too, just to kind of reiterate about, the doctor to go to. There's not, as you were saying, not a doctor to go to that focuses on bone health, but it's a conversation you can have with many different doctors you already see.
But their ability to understand and treat really depends on how interested they are in bone and how much they've done to study it, because a lot of the basics, much like menopause, which could be a whole nother topic of a webinar.
Yes, we should do that for sure.
Is how well they know about, the specifics of it. Because they'll know the general practice guidelines, and most of the time that fits for everybody. I would say if you're not getting the answers you want from your primary care or whomever you're seeing, ask for a referral. It is not wrong, and they should not be offended. In fact, many times when it comes to something tricky, my primary care, love him to death. He refers for everything, and that's great. He has no problem doing it. Ask for a referral to an osteoporosis specialist. That could probably be someone like an endocrinologist or a rheumatologist. Those are the two specialties that are more involved in osteoporosis and tend to have a better understanding of it. But again, it depends, like everything, who you're seeing and where. Another thing then, if you're uncomfortable maybe asking your doctor about it, call your local hospital and ask them if there's an endocrinologist specialist or osteoporosis specialist that they'd refer you to. And that way you can make the appointment and see them, and you don't have to ask your primary care or whatever. You can say, I want to see the specialist. You can do the legwork and just ask them for, to say that it's okay for the referral.
That's a great idea. And really, again, for people to go to bonehealthandosteoporosis.org, send an email to info@bonehealthandosteoporosis.org. I shared that in the chat. I'll share it again via email. Claire, thank you so much. This was so enlightening, such great information. I really appreciate your sharing your wealth of knowledge with us today.
Oh, I'm so glad to do this. And I appreciate you guys very much focusing on this topic. And I realize there's a lot to know. So please, if we didn't answer your question today, please don't hesitate to reach out and ask the question at info@bonehealthandosteoporosis.org. And I'm happy to get back to you.
Thank you so much. And thank you to all of our attendees for joining us this afternoon. I know this was chock full of information, and please do not be shy to reach out at info@bonehealthandosteoporosis.org. Visit their website, bonehealthandosteoporosis.org, and keep an eye out for your email. Well, you'll get a recording of this and the website and email address right into your mailbox. So thanks for joining us, everyone. I wish you all to stay safe, stay healthy, and we'll look forward to seeing you on a future webinar. Bye, everyone.